I am Alex Mebazaa. I'm professor in Paris. My guests are Catriona Jennings. She's cardiac nurse in London, and she will tell us about mobile health and technology. And our other guest is Professor Metra. He's professor of cardiology in Italy. Catriona, what can you tell us about prevention?
Well, I've just been chairing a session in mobile health technologies and focusing on prevention, and it's looking promising, the evidence, although I think it's very difficult for the research to keep up with technology, which, as we know, moves so fast. So using SMS texting, using the internet and social networking to help people to self-manage and prevent disease.
Yeah, and prevention is very important. Professor Metra, acute heart failure is raising disease. Why do we need tricks?
Good question. I mean, of course, this is the opposite. This is the failure of prevention. This is the failure of treatment of heart failure. When the patient decompensates and comes to the hospital, it's a very common condition, but unfortunately the therapy has remained the same in the last decades. And so we need tricks. We need to improve what we have, what we have been having for decades. And so better use of diuretic treatment, better use of vasodilation, use of inotropes only when tightly needed is very important.
But is there still a place for diuretics and vasodilators today in the management of acute heart failure?
Yes, absolutely. Most of the patients are admitted because of congestion, because of fluid overload, and therefore diuretics remain the mainstay for symptomatic treatment. And hypertension is a major cause of decompensation in many cases, and in these cases vasodilators when the blood pressure is above 110, but also in some selected cases also with lower values, but vasodilators surely are the mainstay in the patients with hypertensive pulmonary edema and high blood pressure.
Catriona, there is an increasing role for nurses both in the acute phase and also after discharge when patients are stable heart failure. How would you see the exact role of the nurses?
I think that nurses can play a really important role in helping patients and families to adhere to medicines and to look after themselves, manage their own condition. And maybe that will have an impact on reducing the need for hospital admissions and also improving the quality of life of patients who are having to live with heart failure, and of course their carers and their family members.
Thank you very much. Then we learned that heart failure is really a teamwork. We are of a need of new therapies, both for acute heart failure and chronic heart failure. And we also learned that prevention is probably the best way to go for heart failure.